Good afternoon, and welcome to today's caregiver webinar, Understanding Common Mental Health Conditions in Older Adults. My name is Allegra Jaffe, and I am a social service specialist with the Fairfax Area Agency on Aging. A few housekeeping items before we start today's session. Today's presentation is being recorded, and the recording will be sent to you a week from today. The slides that will be shared today have been emailed to you, and you will get those slides again in an email with the recording. We will do Q&A with our speaker at the end of the session, so you can use the Q&A box to write down questions throughout the session, and we will address those, as many as we can, at the end of the session. And also, we do have a brief survey as you sign out. If you could help us answer those questions, we really appreciate knowing what topics you're interested in so that we can continue to cultivate webinars that are interest our family caregivers. And I would love to introduce our speaker, Karyn Walsh. Karyn Walsh has a master's social worker, and she's a licensed clinical social worker. And she works with adults and families affected by life and health challenges, grief and loss, substance abuse, aging, family and relationships, anxiety, depression, trauma, and other mental health conditions. Working with the NOVA Older Adult Counseling, she uses several treatment methods that best meets the needs of her clients. While she practices with adults of all ages, she has a special focus on older adults and their loved ones. She has a strong background in working in health, including Inova Health System and mental health settings for over the course of her career. Karyn, thank you so much for being here today. Please take it away and join us on camera. Thank you.
Hi, thank you, Allegra. I appreciate you very much. I'm going to try to share my screen. And here we go. Thank you. I am a part of a counseling practice. It's called Northern Virginia Older Adult Counseling, or we call it NOVA OAC for short. I wanted to start with wishing all the caregivers that are joining today special recognition for your month and for your hard work. I too have been a family caregiver to my dad, Pete, and my father-in-law, Curtis. Both were challenged with dementia, and I was a caregiver for each. My father passed away during COVID about 2.5 years ago, and my father-in-law passed away just 3 months ago from dementia. So I very much have both professional experience working with individuals with mental health conditions and caregivers. And I've been a personal caregiver and one during COVID, which came with another whole set of challenges.
Karyn, could you press start from the beginning for us? Would you mind?
Oh, great. Thanks.
Perfect. Thank you.
Okay. Are we good?
It looks great. Thank you.
Okay, great. So I want to start with what were kind of the goals of this presentation. It's to review anxiety and depression, which are the most common mental health conditions in older adults. I've also been asked to address bipolar disorder and hoarding because they can present challenges with older adults as well, since that's our focus today. I have put different links and resources at the bottom of most slides, which if you click on when you receive this presentation, if you want it emailed to you, you can find out more information and more resources for support. And the overall goal today is to help any person affected by a mental health condition, whether you have mental health symptoms or condition, or for your loved ones and for caregivers. I hope you learn more information, resources, strategies, and better ways to go. I want to start with this. I'm going to move something. There we go. Remember that we're all a human being with an individual life story. And so that means that whatever impacts one individual in a way, say somebody with anxiety, it may impact another person with maybe similar symptoms, but it may present them differently, more severely, or more mildly. This is just an important place for us to start, and to also remember that we can all have something going on with us, but we're all a person first. The realities of aging. As we age, it's just simply a truth and a reality that we will have certain life challenges that impact our mental health, such as coping with a serious illness or losing a loved one. Although many people will adjust to these life challenges, some experience more complex or more consistent feelings of grief, social isolation, and loneliness, as well as some other symptoms. And when these feelings persist, they can lead to mental health conditions such as anxiety and depression. A little bit about older adults and common mental health conditions in the United States. The most common conditions, as I've already said, are anxiety first and depression second, as well as severe cognitive impairment. As we age, and especially with the baby boomers coming up, and I'm at the tail end of that generation, we're seeing more and more incidences of things like dementia. And that does present and count as a mental health condition. And it's estimated that about 20% of people 55 or older will experience a mental health concern. Why is mental health an issue or a need in older adults? It has a lot to do with this stage of life that we're at. And I consider myself Club 60. I call that being 68 years of age. And things that happen, such as loss of a loved one, loneliness or social isolation, illness or disability, which can be of an acute or chronic ongoing nature. And with that may come functional limitations that affect our abilities to engage in activities in life on a daily basis. Changes brought on by retirement. Certain medications can affect our mental health and our health. Alcohol use or misuse, as well as other substances and medications. The stress that comes with caregiving, sleep problems, relationships, and a lack of exercise or physical activity. I'm always sensitive to the fact that I think most of us, as we age, we hope to have a positive aging experience and a healthy aging experience. But I'm very aware that there are many people who is very homebound and debilitated, or you yourself may be physically or for some other reason homebound. And so achieving some of the goals to remain healthy and not isolated are difficult. But indeed, social isolation and loneliness, it's very much an epidemic, if not a pandemic these days. And it's a simple human truth that we all need social connections to survive and thrive. And as people age, they can often find themselves spending more time alone. Studies show that loneliness and social isolation are associated with higher rates of depression. The pandemic has done no one any favors, especially older adults. I felt it prudent to speak to the traumas that are going on in this world. And a 2023 study by the American Psychological Association looked at the stress in America and across all age groups, and looking at the effects of widespread trauma, such as the pandemic, global conflict, racism and racial injustice, inflation, climate-related disasters. It's all weighing on the consciousness of America, but I will add, I believe it's weighing on the consciousness of people all over the world. Closer look at those 65 plus. This age group of older adults identifies that the economy at almost a rate of 50% is their top source of stress, followed closely by health-related challenges being a cause of distress or stress. More than 1/3 of adults reported having been diagnosed in 2023 with a mental health condition. And interestingly enough, this was a 5% increase over the pre-pandemic level. Most people cited that anxiety at 24% rate and depression followed right behind it, a 23% rate. As a reaction to stress and a condition that they developed. Interestingly enough, this last bullet point holds a lot of truth here. Those that are 65 plus reported being able to deal with stress better than younger age groups. And this means a certain level of resiliency. I said some resiliency, but I'd like to challenge that it's actually much resiliency. So the resiliency in older adults, you may wonder why I'm starting with this first, and it's because we often forget what we were born with, and that is an instinct to survive and developing a resiliency over our lifetime. In spite of losses and physical declines experienced in later life, older adults actually report feeling content, and they have lower rates of mental illness than the general population. Researchers have also found that due to resilience and an understanding of resilience, it can lead to a healthier, happier person or people and communities. And what is resilience? It is the process of adapting well in the face of adversity, trauma, tragedy, threats, and significant sources of stress that may be very individual to each person. So to survive and thrive, this is something we can all learn from today and in the days going forward, I hope. Resilience is not simply the ability to survive a difficult experience, but the ability to adapt and cope with circumstances in a way that enables one to emerge stronger, to thrive in the aftermath, and to integrate the lessons learned. These are traits that can be learned and can have an effect on positive aging, on your health and wellness as it relates to healthy aging. Interestingly enough, older adults are often undiagnosed or untreated for mental health conditions, and there are several reasons given for this. There are negative stereotypes of aging. For instance, the idea that it's normal for people to get lonelier or more unhappy as they age. Depression and excessive anxiety are actually not a normal part of growing older. They're signs of treatable symptoms, or they're a treatable condition, just like diabetes or hypertension. There's often a social stigma, social stigma is negative beliefs or misconceptions about mental health issues, surrounding mental health issues today. There's a lack of awareness and education about mental health, and this can lead to discrimination against people with mental health challenges, making them less likely to seek help and treatment. An example of that is when we use the word, oh, somebody's crazy, or somebody's a real hot mess, we may know that to a certain degree, but that doesn't help them or ourselves seek the help that we need, and really understand what mental health is just as much as our physical health. There are also practical barriers, such as the lack of transportation, technology challenges, insufficient insurance or the cost of treatment, and finding a counselor who will accept Medicare. I wanted to start out today. What is mental illness and what is a mental health disorder? It refers to a wide range of mental health conditions that affect our mood, thinking, and behavior. Our mood is actually a temporary state of mind or a feeling, such as feeling sad, feeling mad, or feeling happy and joyful. Our thinking is an idea or an opinion by thinking, or something that suddenly crosses and comes into our mind, like, wow, that sounds fantastic, or no, there is absolutely no way I can do that, no way at all. Or a behavior is how one acts or conducts oneself towards others or situations. I wanted to start with a bit in general, signs and symptoms of mental health conditions, and most of these are captured in the rest of my presentation. But feeling sad or down, confused thinking, or reduced ability to concentrate, excessive fears or worries, extreme feelings of guilt, extreme mood changes of highs and lows, withdrawal from friends or activities, significant tiredness, low energy or problems sleeping, detachment from reality, such as delusions, paranoia, hallucinations, symptoms. Continued mental health symptoms can be the inability to cope with daily problems or stress, trouble understanding or relating to situations and to people, problems or misuse with alcohol and drugs, major changes in eating habits. We'll speak a little bit more about that. Sex drive changes, excessive anger, hostility, or violence, suicidal thinking, planning, gestures, or attempts. These are in general many mental health symptoms. Mental health symptoms can also present physically, and this is not a conclusive list that I'm sharing, but stomach pain and nausea, heart palpitations, back pain, headaches, other unexplained aches and pains. And that's why it's always important to see your doctor or take your loved one to see their doctor to rule out any physical cause of these distressing symptoms. What is depression and does it look like in older adults? Depression is actually a serious mood disorder affecting the way we feel, think, and act. It is not a normal part of aging. Feeling down every once in a while or in response to stress is a normal part of life, but when these symptoms last at least 2 weeks and they interfere with a person's ability for daily tasks, someone may actually or may likely qualify for a diagnosis of a mental health condition. Depression often goes underdiagnosed in older adults because signs of depression can be misinterpreted or interpreted toward a physical condition or medication, such as difficulty sleeping, loss of appetite, lack of concentration, and forgetfulness are all signs of depression, but they can be signs of other health conditions. Studies actually show that most adults feel satisfied with their life despite having more illnesses or physical problems than younger people. If you've experienced depression as a younger person, you may be more likely to experience depression as an older adult. Factors that contribute to depression are brain chemistry, an imbalance in our neurotransmitters, including serotonin and dopamine, can contribute to the development of depression. Your genetics. You have a first-degree relative, parent, or sibling biologically. With depression, you're 3 times more likely to develop the condition versus the general population. However, that does not mean you will develop depression. However, you can have depression without a family history. Stressful life events, such as the death of a loved one, trauma, divorce, isolation, lack of support, can trigger depression or depressive symptoms. Medical conditions can be a source that contributes to depression, such as chronic pain, other chronic conditions, or the effects, like the late effects of cancer. Conditions like diabetes can lead to depression. Medications such as alcohol, Other medications can cause depression or can make depression or depressive symptoms worse. So symptoms of depression are persistent. And remember when I said 2 weeks, because in our, to be clinically diagnosed with depression, having these symptoms almost every day for the past 2 weeks or over a 2-week period or longer qualifies as a depressive diagnosis. You are persistent, sad, anxious, or have an empty mood, blah. And feelings of hopelessness, guilt, worthlessness, or helplessness, irritability, restlessness, or having trouble sitting still, loss of interest in once pleasurable activities such as sex, decreased energy and fatigue, aches and pains, moving or talking more slowly. If you notice that when you don't feel well or you're feeling very low and you're kind of dragging, and we hear that a lot. Somebody says, I'm just kind of dragging today, or I've just had a lot of pajama days, and and I just don't feel like getting out of bed, a bit apathetic, not feeling motivated, difficulty concentrating, remembering, or making decisions, difficulty sleeping, such as waking up too early in the morning, waking up too much all night, and oversleeping. And that waking up too early or many times in the night, that's not just difficulty, or if you have many bathroom breaks for a physical reason. So also if you eat more or less than usual, usually with unplanned weight gain or loss, and if somebody experiences thoughts of death or suicide or self-harm or suicide attempts. And I wanted to put a special note here that if you look at these slides, how many symptoms can be attributed to a physical illness or cognitive impairment, such as dementia or brain injury, such as a stroke? So that's why, again, it's really important to have a good medical evaluation to help tease out and diagnose the cause of what you're going through and the symptoms you're experiencing. There are types of depression that are related to substances like alcohol and pain medication, a depressed mood that lasts for more than 2 years, but the person is actually able to function and take care of themselves for the most part on a daily basis and complete different daily activities and daily living. Depression can be related to the use of substances such as pain medication or alcohol. Depression is related to their medical conditions such as multiple sclerosis, cancer, heart disease, or cognitive impairment such as dementia or a traumatic brain injury. Other types of depression I just wanted to kind of scoot in here are psychotic depression and menopausal depression and seasonal affective traits of depression, such as when the seasons change, such as recently, and you feel a little more fatigued, a little more blue. That's actually very, very real in folks. Wanted to mention older adults and suicide. Older adults actually have the highest rate of suicide compared to other groups. People aged 85 and over have the highest rate, followed closely by adults 75 to 84. Mental illness is often a factor in cases of suicide. And older men have the highest rate of suicide of any group. Now, I found different sources that said that older adults have the highest rate of suicide, but I found it prudent to also share that I found other sources that said that middle-aged adults actually also had a high rate of suicide. The point is, it's a real problem in both of these. Bipolar disorder in older adults. This actually affects very low percentage of older adults, 1 to 5% of all older adults. Bipolar disorder is formally called manic depression, and it's a mental health condition characterized by extreme mood swings and very rapid mood changes. For the emotional highs, that can be mania or hypomania, and the lows are symptoms of depression. Manic symptoms are increased energy, excitement, impulsive behaviors such as too much shopping, spending too much money, and agitation. Depressive symptoms are just a lack of energy, feeling worthless, very low self-esteem, and often suicidal thoughts with bipolar. Bipolar disorder is actually diagnosed most often in the later teenage years and the early 20s. And so from a counseling practice experience, many of the older adults that we treat actually have learned a lot about how to manage their bipolar symptoms as they've aged because they've had an adult lifetime to do it. The symptoms can vary from person to person, and they can vary over time. The best treatments typically for bipolar disorder are medication and psychotherapy. Not everybody's going to agree with that statement, but that's what researchers and science says. And if left untreated as one ages, bipolar can lead to increased hospitalizations and suicide attempts. Anxiety, some facts to share. This is the most common illness among older adults with a 20% prevalence rate. Although as depression, it often goes undiagnosed. Phobia is actually the most typical type of anxiety. And it's when an individual is fearful of certain things, places, or events. Among adults, anxiety is the most common mental health problem for women and the second most common for men after substance abuse. Feeling anxious or nervous, again, is often a common emotion for people of all ages and a very normal or natural reaction to stress. And feeling anxious in many circumstances can motivate us to do something better or different. However, when one feels anxious often, or when the anxiety is overwhelming and affects our daily task or our ability to do daily tasks, our social life, our relationships, and our being, it can be a mental health condition. Symptoms and signs of anxiety: excessive worry or fear, refusing to do routine activities or being overly preoccupied with routine, avoiding social situations, overly concerned with safety, racing heart, shallow breathing, trembling, nausea, and sweating, poor sleep, muscle tension, feeling weak and shaky, hoarding or collecting. I'll speak to that a little bit more in a moment. Depression, and self-medicating with alcohol or other medications. Physical symptoms of depression, speaking again to the importance of a medical evaluation first. Racing heart, heart palpitations, trembling, hot flashes, headaches, frequent urination, shortness of breath, nausea, or tense muscles. When I share this list often with clients, they'll say, oh, was it anxiety and not so-and-so, such as a physical condition? But it is very important to rule out a physical cause first of symptoms that you're having that of anxiety or depression. Types of anxiety disorders. Generalized anxiety disorder is a prevalent condition that we see in older adults. And it involves a persistent feeling of anxiety and dread, which interferes with their daily life, can last months or years. Panic attacks, which can develop into a panic disorder. And these are sudden periods of intense fear, discomfort, and a sense of losing control when there is no clear danger or trigger. People with panic disorder often worry about their next attack, when their next attack will happen, and actively try to prevent future attacks or avoiding places, situations, and behaviors they associate with panic attacks. Phobia is an intense fear or an aversion to specific objects and situations. Specific phobia can be an intense fear or anxiety in relation to snakes, blood, or planes, airplanes, riding airplanes. Phobias that are most common in older adults are fear of death, disaster to family, and dental procedures. And I'll share a little something with you. I share your somewhat heightened anxiety or fear with dental procedures, but I found a very good dentist, gentle. Anyhow, facing or thinking about these situations or things can bring on severe anxiety or a panic attack. Panic attack is characterized by chest pain, heart palpitations, shortness of breath, dizziness, or nausea. Social anxiety disorder is an intense or persistent fear of being watched or judged by others, such as public speaking and examples like that. Agoraphobia, examples of that are a fear of being enclosed, such as in an elevator, a fear of being in crowds or using public transportation. Although post-traumatic stress disorder, it used to be characterized in anxiety disorders, but it's not. It's now characterized in the mental health field with stress and trauma conditions. But I felt it prudent to include it here because we do see older adults still being triggered with symptoms of a past trauma or a current trauma or both. PTSD or trauma symptoms develop after a traumatic event that involved physical harm or the threat of physical harm to an individual, a loved one, or strangers. It can also develop after a traumatic incident or witnessing a traumatic incident, such as a mugging, rape, abuse, car accidents, or natural disasters, or experiences of war. Some adults, older adults, may actually relive a trauma 30 years or more after an event due to feeling helpless because of a new disability, taking away some of their control, or specific triggers may revive old memories, such as news coverage of current wars is one very prevalent example, or the political scene and divisiveness. Symptoms of trauma may startle easily, be emotionally numb with people with whom they were once close, having difficulty feeling affection or lose interest in things they once enjoyed. Some folks may experience flashbacks, irritability. Some may be aggressive or violent. Obsessive compulsive disorder actually has a very low incidence in older adults, but it is tied often to hoarding disorder. So I gave it a little more verbiage here. This is when a person experiences uncontrollable and recurring thoughts called obsessions, engages in repetitive behaviors, compulsions, or both. An example of that would be the need to be clean, and the behavior would be consistently and always washing your hands. People with OCD have time-consuming symptoms that may cause significant stress or interfere with daily life. OCD is not that common among older adults, but folks with OCD who do have it are preoccupied with order and symmetry, and it can lead to hoarding unneeded items, and we'll get to that in a moment. Adult anxiety and depressive symptoms often come together, and in older adults, we see this very commonly in our practice. And I believe other clinicians or counselors would say the same. You may not have two full diagnoses of anxiety and depressions, but may certainly have symptoms and or one of the other conditions. Both can be debilitating and reducing your overall health and quality of life. And that's why it's important to know the signs of anxiety and depression, and your doctor is one person to begin talking with those concerns about. Wanted to speak to the importance of recognizing culture. Sometimes symptoms of anxiety and depression present very differently in different cultures. Sometimes, for instance, they can present more as physical symptoms and aches and pains. Because grief, which is a natural response to loss, is a very common experience in older adults, both death-related and non-death-related losses. I felt it prudent to include that there is actually a difference in the symptoms between grief and depression. Depression has been found in almost close to between 30 and 35% of people who are grieving the loss of a loved one. The outlook for those suffering from grief and depression continues to be positive. I've included a slide here that speaks to the prevalent symptoms and emotions in uncomplicated grief and depression. And if you'll notice, on the depression side, it's more persistent sadness, hopelessness, and despondency, constant and unrelenting distressing emotions. It is uncommon for a severely depressed person to be able to experience positive emotions. They're simply more challenged if they're severely depressed. Focused if they're depressed versus just grieving. A much lower self-esteem, more self-critical, and more hopeless and despairing in general, but not always. Feelings of worthlessness, shame, and self-hatred can occur. And the underlying motivation in those with depression, they want to relieve the pain and despair. And they often feel worthless and unworthy of living. I'm going to let you, the uncomplicated grief symptoms are loss and emptiness, a longing for the deceased loved one, what we call grief waves. They come in and they tend to decrease in intensity and frequency over time with someone that is grieving versus clinically depressed. Another experience of someone who is grieving, they tend to be able to have moments of humor, comfort, peace, hope, happiness can still occur. They're focused on the deceased and their related losses. Their self-esteem is not usually impacted, but sometimes it is. And if there are suicidal thoughts, the underlying reason is due to wanting to be reunited with their loved one. Mental health and suicidal symptoms. Many of depression, bipolar, PTSD, they have a heightened risk of suicidal thoughts and attempts. Some of those symptoms, despair, emptiness, hopelessness, can lead to someone trying to take their life or contemplate it. And so seeking help for suicidal thoughts or behaviors is really important. And I've included our local crisis link phone number, and I've included the text or call the National Suicide Prevention Lifeline at 988. They are there all the time, every day and night. And I also find it prudent to share with the clients that I work with that if you do need to make a call to the local crisis link with the National Suicide Prevention Lifeline, less than 1% of the thousands of calls they receive in a year do they need to call 911. So that means they have a 99% rate of trying to help somebody through what is a very emotional or personal crisis. Hoarding and collecting. A person that hoards has a strong desire to save a large number of items, whether they have any monetary value or not. They experience significant distress when attempting to get rid of the items. It impairs their daily life. They often hoard newspapers, magazines, household goods, and clothing. They can accumulate a large number of animals who are usually not properly cared for. So that's the difference between hoarding and collecting. For hoarding disorder to be diagnosed, a person needs to have ongoing difficulty getting rid of their possessions, whether they have value or not. They feel a strong need to save these items, and feelings of distress are associated with discarding them. Their living spaces are often so filled with possessions that they're unsafe or unusable. Different levels of hoarding. There are different levels of hoarding that go from mild to severe and dangerous. People with hoarding disorder rarely seek help on their own. It is often the distress of their loved ones, their friends, a medical or mental health professional, animal control services, or a social worker who initiates some help with them. You can find more information in that link at the bottom. Hoarding affects approximately 6% of older adults, and it often starts in adolescence and gets worse as the person ages, often beginning in their mid-30s with collecting more things. OCD, depression, and ADHD are a diagnosis often associated with those who have hoarding disorders, but a person can hoard and not have OCD. Hoarding disorder is often seen as self-neglect or elder self-abuse, speaking to the impairment of these hoarding behaviors among older adults. They can lead to dangerous clutter, interfere with their daily life, and it causes a lot of shame and stress to the people that care for them and about them. We're going to now move into depression. I mean, not into depression, but treatment. And I hope we have some hope here and a few smiles on your faces. I love the words, I am trying. I want to be a good human being. I want to just try my best. I'm working at it. So often change in life and change in ourselves is a process, practice, and trying. There is hope. Anxiety and depression can be successfully treated. There are highly effective treatments for these conditions in older adulthood, and you can dramatically improve your life and your well-being with treatment. People with hoarding disorders can be treated as well. It is often longer and more complex, however, but there's definitely hope there. It's important, I think, to recognize that we all have our basic and important psychological needs as human beings, and that is to be loved, to give love and receive love, and to be known. And the very important developmental stage in older adulthood, just like when you're a baby, it's to trust or mistrust, that you learn those basic skills. In older adulthood, it's called integrity versus despair. And that is to maintain some worth, dignity, value, purpose, relationships, connections, versus despair, loss of socialization, purpose, meaning, and despair. This is the challenge for most older adults. Leading with compassion, whether you're a family caregiver or a person with some mental health symptoms or a condition, this is an important place for us to all start, because we all respond better if we treat ourselves with loving kindness when we treat someone else with loving kindness. There's a good article down at the bottom of this that you click on, and it's self-compassion and compassion are just shown to consistently be associated with the benefits of mental health and well-being across all diverse populations. Often it's really hard to get people to talk about their stress and mental health. So the first step is being aware and asking for help. And a lot of people don't. About 3 in 5 adults say they actually don't talk about their stress overall because they don't want to burden anyone else. But who can you talk to? And how can you talk to someone? How can you talk to your loved one if you're a family caregiver? That first bullet point, begin with asking questions, taking the initiative, asking how your loved one's feeling, being supportive, listening attentively, and listening attentively without the need to respond right away, in which you've already decided. And I do know how hard this is. Ask if there's anything they're feeling anxious or sad about. Ask if they're especially tired or stressed. Often people need a listening ear, and this is true as we get older. Asking a doctor and having a medical evaluation. Seeking a mental health professional, such as a psychiatrist, psychiatric nurse practitioner, another licensed mental health professional, such as a licensed clinical social worker, licensed professional counselor, licensed nursing mental health professional. Asking our pharmacist questions about medications we're taking, and can something be the cause? And because this last bullet point, asking someone, many older adults come into contact with someone or can make a call to their local office on aging, their senior center, Northern Virginia, we have Shepherd Centers that do a fabulous job of being sources of socialization, purpose, friendly visiting, friendly calling, and resources for information. And many older adults live in a community where they may have access to someone that can help them. I know that there's several housing like at Ollie Glen, and they routinely have someone there that can help with different questions. So hope is very much very real. Treatments for mental health conditions. They often start with medication and psychotherapy, as well as ways you can help yourself or your loved one. Psychotherapy. It's called talk therapy or counseling, and counselor specifically helps look at what you're going through and what you're challenged by, your beliefs, your thoughts, emotions, behaviors. They may need to kind of, explore with you your past and how that might be impacting your present. And the goal of therapy is to help you take control of your inner life, yourself, and how you can respond to challenging situations with healthy coping skills. You often learn ways to reduce or manage stress, anxiety, and depression, and work on goals that you identify for yourself. Also wanted to include that therapy can be done as an individual, a family, a group, or peer related. This is a slide on some different types of therapy. Cognitive behavioral therapy is up there in the left-hand corner. That's a very prominent type of therapy, but most of us use a little bit of each. We call that eclectic. A little bit of each. It's what works for that person and helps them achieve their goals. Medications to treat mental health conditions. You can talk to your primary care doctor or a psychiatric professional. There are so many of these that I've included a link here that you can learn more about the different medications to treat mental health. It's important to be consistent and stick to a treatment plan, ask questions. Treatment for depression in adults, psychotherapy, medications, complementary treatments such as hypnosis, massage, biofeedback, acupuncture, brain stimulation therapy such as ECT or shock therapy, something called TMS, transcranial magnetic stimulation, or vagus nerve stimulation. Good self-care practices, limiting alcohol or avoiding alcohol because this can be a depressant. Medications, again, for anxiety and or depression, exercise, avoiding alcohol and recreational drugs, limiting nicotine and caffeine as they can make anxiety worse, stress management, relaxation techniques, making sleep a priority, good nutrition, identifying triggers. This is something we do a lot with folks with anxiety and depression, learning what situations or actions cause distress, and learn strategies to help face these triggers and reduce your stress and how you can respond. Keeping a journal, also like a weighted blanket. This is not a comprehensive list. Anxiety medications are very effective as well as an option to treat anxiety, panic attacks, social anxiety, treatment for suicidal symptoms. The whole goal is to prevent suicidal behaviors. Another goal is to motivate the individual. It's for the therapist to help motivate the individual or their loved one that they're better equipped to deal with suicidal impulses and thoughts and reduce the risk of suicide. And we do a lot of a safety plan with folks. What are some coping skills and resources they can reach to help save their life and reduce their risk for self-harm? And if you love someone or caring for someone who is suicidal, a bit of a slide here that kind of reiterates some of the things that we said, but keeping them safe, not leaving them alone if you're physically with them, asking them questions, and reaching for help as needed, like with 988, that crisis line, or taking them to the ER or contacting their counselor. Treatment for bipolar is often done with, again, medication and therapy, and lithium has been a long-standing mood stabilizer. I find that people with bipolar disorder who, unless they've learned some really great coping skills, that's wonderful, but they're really challenged without medication and therapy to be stable with their condition. But I don't say that that's for everybody, because, so anyhow, specific to hoarding disorders, this is often treated with a skills approach with CBT or cognitive behavioral disorder, and it's helping somebody challenge the thoughts that they have about what they're holding on to and what the value is, and it's often phases of helping them move those things on to their next chapter. That's the way I say it. And often, and going into treating somebody with hoarding disorder with compassion. And the first goals of treating hoarding disorders are harm reduction and safety, unblocking those doors and windows, creating a space to sit, a clean place for medications and food, learning more about your condition and mental health condition, and researching about it, learning about it. This helps somebody understand what they're going through, and that you actually, there's a name to what you're dealing with, and that there's a way to deal with it and overcome it or manage it or reduce its symptoms. Your attitudes and perspectives. Accept that some things are out of our control, but take actions on the things you can. Trying to look for the silver lining and look for the lessons you can learn in the situation. It's self-care, controlling or managing the stress as much as possible with things like meditation, yoga, good nutrition, good sleep, keeping your brain active and engaged as well as your body. And again, I realize there's a number of folks with functional limitations, caregiving responsibilities, and it's harder, you're more challenged. But there are ways to do that. I also tucked in limiting your news exposure these days and not keeping that tube or devices, electronic devices on all day, actually disconnecting from them. Put some information here on meditation, put some information on mindfulness to reduce stress. And the goal of these are to help you reduce your inner self so that you can deal with the challenges of life and what's in front of you. Because if you can calm yourself and your brain, your body, your nerves, you are doing yourself and your loved ones the biggest favor, because then this reduces your stress. It really does, and how you can respond to it. I've included some links to some free mindfulness and meditation resources. I've included in that third bullet a HALT practice. We're much more likely to be angry, distressed, anxious, or depressed if we are halt, hungry, anxious, lonely, tired. And there's a great meditation that leads you to recognizing those symptoms and doing some gentle breath work, which is slow, deep breathing and releasing some of that angst. Practicing these coping skills. I know we can talk the talk. We actually have to walk the walk and just give it our best shot every day. And that's what we have every day. The sun does come up tomorrow, and with a new day, you have a new opportunity to just try and practice some of these coping strategies. Not struggling alone. A lot of folks are going through this, and there are ways to engage by phone, virtually, in person, And I've put some wonderful resources down there through Family Services in Fairfax, the Community Services Board, and positive social supports. You're not meant to live as silos, not alone and isolated. It's important for somebody to know that you're alive today. Even if you send a person a text and they text you back, even if you have to call someone and say, hey, I'm doing okay, I'm out here, or I'm not doing okay, I could really use a call back. And get creative, think outside the box. That last bullet point, allow yourself to have invited scheduled social calls or visits from very vetted groups like the Shepherd Center, and there's some services through the Fairfax County, older adults, including caregivers. And I did put George Mason down there. They have an entire online institute and in-person classes for older adults. We spend 1/3 of our life sleeping. Get some good sleep as the best you can. Consistently poor sleep is associated with anxiety, depression, and mental health conditions. Develop good coping skills. I've mentioned some of these and practicing them. Here's some ideas. Finding humor. Your little Golden Girls marathon. When we're laughing, we can't be depressed. When we're smiling, when we do an intentional belly laugh, you're giving yourself a break for a moment, and it's a good place to start. Reading, music, art, exercise, some time to yourself. The Fairfax County Library gets their own shout out here because they do some great work with folks who need access to books, hard copy, ebooks, movies. They even have an all access book club that's held over the telephone. And you can access these services online, and you can call and they will do it for you. All that information's on that slide. Building your resilience. You are not done yet in life as an older adult. And so you can help be the architect toward improving your own well-being. And again, here are some ideas to do that: volunteering, giving support to others, sticking to a realistic budget, identifying your moods, seeking help, whether it be for a physical or mental health condition or symptoms, and learning to be at peace with yourself. I've included some tips for caregivers on these slides. Accepting help, asking for help, focusing on what you can do versus all the things you can't, setting manageable small goals you hope to reach. And remember, that to-do list can be shifted to tomorrow many times. Prioritize, get connected, joining a support group, seeking social support, taking care of your health as best you can, sleeping, seeing a healthcare or mental health care professional. This last slide, I've included some resources for older adults and caregivers, ways to find a therapist, and both the older adults Fairfax Office on Aging and Persons with Disabilities and the Family Caregiver Support Program. You can reach them online or in person. Not in person, but by phone. And last but not least, I wanted to leave 1 or 2 minutes for questions. I'm sorry, I kind of went on and on, but I want to thank everybody today.
Thank you so much, Karyn. Valuable, great information. Really appreciate it. I know we're getting close to the end of the hour. Can you stay on for an extra 5 minutes by chance? Or
sure, I can.
that'd be terrific. So just to let the audience know, we're going to stay on a little extra to get some questions in. So you can submit your questions now in the Q&A box, and we'll try to get to as many as possible. The first question that came in, Karyn, was there's someone in the audience who was seeing a psychiatrist that accepted Medicare, but they no longer accept them. So the question is, how do you find a psychiatrist who's accepting Medicare? Or do you have suggestions on how to find that?
Absolutely. whatever that person's insurance is, Medicare, you can go to medicare.gov and they actually have a providers list on there of mental health professionals, including psychiatrists, and I give a buzz for psychiatric nurse practitioners and psychiatric uh, 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 PAs, physician's assistants, because they are often forgotten how the great work they can do, and they work directly or have a relationship with a psychiatrist. Ask if you have a Medicare Advantage plan, call them and ask them for a list of psychiatrists who are credentialed with them. You can also go on Psychology Today, and there's a way to enter that and filter who accepts Medicare and if you have a specific Medicare Advantage plan. Those are my suggestions with that.
Thank you so much. Another question, can anxiety present less attacks and more of difficulty, more forward and needed task? Obsessing, such getting stuck on, or must finish one long-term task before moving forward on another thing?
Say that. Repeat the beginning of that
Yeah,
question.
so can anxiety present less as attacks and more of difficulty moving forward and like needing to do
Absolutely, absolutely. A lot of anxiety might be running around in your head, and I call that the hamster wheel. And so, yes, anxiety, although phobias and panic attacks may be a common experience, anxiety often does not present as anxiety attacks and phobias. So I think that's an important clarification point this person is raising. It can start with excessive worry, fears. We call it fatalistic thinking, like, oh, the world is going to end tomorrow, and catastrophic thinking. Hope that's helpful.
Thank you. Yes, it is. Can you speak to food hoarding and how to deal with food hoarding with an older person? And that might be too general, but
no, I don't think so. It is a very complex and very difficult condition for the person experiencing it and for the person. I often recommend that people get you can call your Fairfax, like an office on aging, because those folks know people in the community who are providers who may be able to give you a consultation or more information on resources and ways to approach that person. That's actually a great question. But I think finding out more about it and finding out what your sources are and coming up with plan and strategies of how to try to help that person. I hope that's helpful.
Thank you. What are your thoughts on EMDR?
Great. EMDR is a wonderful treatment. It's just one of the treatments for anxiety. For trauma. But it is a great, I'm sold on it. And the whole thing about EMDR is making sure you get somebody who's very qualified in it, because somebody's gone through extensive training to be able to provide that. But I think it is one of many effective treatments for trauma.
There is someone who's asking if you can recommend a sleep aid. I'm thinking you may want to go to a doctor, but what's your thoughts on that, Karyn?
I think that person needs to ask their doctor. Everybody's body is different, and that's why there are psychiatrists. They'll actually do a test from your mouth, that a little swab, and they can find out from doing some test on that as to what medications may or may not work best with your body and what you're dealing with. So again, you're right. I would leave that to a medical professional.
Okay. And there is a question about the library slide, and I just want to let the audience know that all these slides are being emailed to you. And if you didn't get them, you'll get it with the email in the recording, so you can click on all the links that Karyn was discussing. Another question came in is, what is EMDR?
Eye movement you're going to find out I trip over some words,
Yeah.
desensitization movement. And it is an intervention that helps look at both your left and your right sides of your brain. It helps you develop the ability to ground yourself or self-soothe, teaches you strategies that when you're triggered by trauma or feel unsafe, to help calm yourself down, and also to help perhaps rewrite the narrative of in your head of what happened a long ago, and maybe not change it, but look at it in different ways that help you feel safer and able to manage in the present from what happened to you in the past. And for all those who, I hope I did it justice. That's my best shot at it. I'm not an EMDR professional, so there. I recommend asking one or Googling it. So
Thank you so much. And I know we're past the hour. We're at 1:05, so I want to respect everyone's time. And I thank you again so much, Karyn, for this great information. We really appreciate it. And I want to thank the audience as well for taking your time. And I know your time is very valuable. So thank you so much for being here with us today. I wanted to remind everyone there is a brief survey as you sign out. Please feel free to share any comments there with our speaker. Let us know other topics you would like to see for next year. And also, I want to invite you to our next caregiver panel, which will be Friday, December 1st from 2 to 3 p.m. on providing care at the end of life. Again, thank you so much, everyone, for being here. Karyn, so appreciate your time.
thank you, everyone.
Thank you. Take care, everyone. Have a good day.
Bye.
Bye.